In this video, we'll be going over more infection control. There was a part 1, this is a part 2. In this video, we're going to be talking about isolation precautions, personal protective equipment or PPE, and the diseases that require these precautions. We will be critically thinking and learning through doing 5 questions. I will read the question to you, then I will pause to let you think for a second. Then I'll read the 4 choices, and then we'll discuss why the answer was best. If you want more information on this subject, you can usually find that in the infection control, foundations, fundamentals, concept area of your nursing resources. So let's get started. Question number 1. The nurse is evaluating a certified nursing assistant or CNA. Which of the following shows the CNA's understanding of standard, which used to be called universal, precautions? Is the answer number 1, the CNA wears gloves during all client contact. Number 2, the CNA hand sanitizes before and after patient contact. Number 3, the CNA hand sanitizes after accidentally getting hands visibly dirty. Or number 4, the CNA puts on gloves to take vital signs. And the answer here, which one is correct, is number 2. The thought about universal precautions is that hand washing is the best prevention. We should be hand sanitizing unless hands are visibly dirty, then we should use soap and water. And the CDC states to wear PPE only when there is risk of exposure to blood and body fluids except for sweat. And the nurse should know that PPE can be added, so if there's a potential for being splashed, then you can definitely wear a gown, you can add the facial shield and the mask, as well as the gloves that you would already have on when you're going to be exposed to body fluids. So the answer is number 2, and in this further learning, there's a hint down here that you can use, the standard precaution hint. We use standard precautions for all patients, we hand wash, and we wear PPE relevant to the risk of exposure to body fluids except sweat. So gloves for anything wet except sweat. 2. Based on the nursing diagnosis of risk for infection, which intervention is best for the nurse to implement when providing care for an elderly incontinent client? Is it number 1, to maintain standard or universal / enteric precautions? Number 2, assess skin integrity every shift. Number 3, insert an indwelling urinary catheter. Number 4, instruct the client in the use of adult diapers. The answer here is number 1, to maintain the standard enteric precautions. In the question, make sure you focused on the topic of risk for infection, not incontinence. That could have changed the direction of your answer. So the thought is just the best way to avoid infection is to practice standard precautions. In the further learning, just to let you know that enteric precautions specifically refer to somebody that has diarrhea or GI contents, and just reminding the nurse to make sure to put on a gown when coming into contact with these bodily fluids. Number 3, patients with which of the following diseases require contact precautions? Select all that apply. Is it number 1, multi-drug resistant Staph aureus or MRSA? Number 2, vancomycin resistant enterococci or VRE? Respiratory syncytial virus or RSV? Or number 4, pertussis, which is whooping cough. And the answer here is number 1, 2, and 3. And the thought is just what diseases require contact precautions, and it's those that are multi-drug resistant organisms. That would be numbers 1 and 2, MRSA and VRE. Anything that's a skin infection, and anything that has excessive drainage. And in this one also, don't forget that RSV, that pediatric disease, is both contact and droplet. Pertussis is only droplet. Pertussis is not contact too. So down here in the further learning, there is a contact precautions hint as well. So contact precautions are used for MDROs, which is those multi-drug resistant organisms, viruses and bacteria that involve the skin, and areas with excessive drainage. And the nurse should wear gloves and gown, even if not directly touching the patient, because the surfaces may be contaminated. And so even if the patient isn't in the room, you should still wear a gown and glove because you don't know where that patient just was. And if you touch the area, you might put it on your pants and bring it home with you and into other patients' rooms if you don't have a gown on. Number 4, a nurse is taking care of a patient with rubella. The patient is on droplet precautions. The nurse has received the MMR vaccine and is immune. Which behavior by the nurse indicates understanding of precautions with this patient? Select all that apply. Is it number 1? The nurse encourages those not immune to rubella to wear a mask, gown, and glove when entering the patient's room. Number 2, the nurse wears a mask when entering the patient's room. Number 3, the nurse does not wear any protective equipment when entering the patient's room. Number 4, the nurse puts a surgical mask on the patient when the patient leaves the room for a test. The answers here are number 3 and 4. So this is kind of a loaded question. One, you have to have the understanding of droplet precautions, which is just to wear a mask. And the other thing you have to have an understanding of is if the healthcare provider is immune and is vaccinated and they can't catch it, then they don't have to wear PPE. So if we summarize that in the thought, it says those not immune to rubella should wear a surgical mask. Those immune do not need to wear PPE. And then when the patient does go out of the room, they should put a mask on. So if we true false to this, like is recommended for select all, number 1 is false because people don't need to wear a gown and glove. This is not a contact disease. Unless it was congenital rubella in your babies, then that would be, but this is not. It doesn't say it is, so we're not going to assume it is. Number 2 is false because the nurse is immune. If the nurse was not immune and not vaccinated for rubella, then the nurse would have to wear a mask, but ideally, any providers not immune in this situation should not be assigned this patient anyway. Number 3, why was that true? Because the nurse is immune, does not have to wear a mask. And then number 4, that was true because yes, you should put a mask on the patient when they leave the room. So the further hint down here for droplet precautions is to remind yourself that droplet precautions are for any bacteria and virus that infect the respiratory tract. And we just need to wear a mask. No gown and glove are needed. Question number 5. A nurse is caring for a client with tuberculosis. Which of the following statements by the nurse to the patient indicate the nurse understands airborne precautions? Is it number 1, I will wear the N95 fitted respirator to make sure you don't catch anything from me? Number 2, this is a negative pressure room. When I open the door, air comes into the room and is ventilated to the outside. Number 3, you need to wear an N95 respirator when you go to your test. Or number 4, I will wear a gown and gloves because tuberculosis is also contagious by contact. The answer here is number 2. Airborne precautions involve negative pressure rooms, N95 masks, no need for gown and gloves, and surgical mask if the patient leaves the room. So I want to quickly go through these. Number 1 is wrong because the respirator stops the nurse from catching TB, not the other way around. Number 3 is wrong. Don't put the respirator on the patient because that allows their exhale to come out into the hallway. They should have a surgical mask when they go to a test. And number 4 is wrong because tuberculosis is only N95. It's not contact. Doesn't need that gown and gloves. So in the further learning, there is an airborne precautions hint here as well. And that is for measles, which is rubeola, not German measles, which is rubella. That's droplet precautions. This is measles or rubeola is airborne, as well as varicella zoster, which is chickenpox, herpes zoster, which is shingles, and then the one we all know, tuberculosis. That requires negative isolation in N95. If the nurse is immune to varicella and zoster, PPE is not required. That is not the same for measles. Even if you have immunity to measles, the CDC still recommends that an N95 be worn. Now, most of us know that measles, chickenpox, and shingles really exist on the skin. So what we're saying here is that these viruses can also infect the respiratory tract, and when the patient is coughing, these are very small vesicles as well, very small, and can float around in the air just like tuberculosis can, and therefore all these four require the airborne isolation, the airborne precautions. In these few slides, I'm going to review just the different diseases for each contact precaution. It's a little helpful slide. You can even take a screenshot of this. The first one is the contact precaution diseases, where we wear gown and gloves. Try to simplify it. There's four bullet points here. The first one is just to know it's for multi-drug resistant organisms. That's like your MRSA, VRE. It's also for some viruses that can live on surfaces, like the respiratory syncytial virus. Even like your herpes simplex or your varicella, your zoster, and some of your viral hemorrhagic fever diseases. The third bullet point is don't forget things on the skin you should wear contact precautions for, like the impetigo, lice, scabies, and even eyes, drainage from the eyes, and conjunctivitis. And then the fourth bullet point is just saying any wound, it doesn't matter what it is, but any wound with excessive drainage, fecal incontinence, other discharges from the body, go ahead and put a gown on as well, gown and gloves. This slide is your droplet precaution diseases, where we wear a mask. There's only 2 bullet points here because the first bullet point is just any bacterial infections that cause respiratory issues like diphtheria, Hib, Neisseria, meningitis, your pneumonias, your meningococcal pneumonias, your pertussis, whooping cough. Most of these can come off precautions once they start antibiotics for a certain amount of time. The second bullet point is your respiratory viral infections, the flu, mumps, parvovirus, adenovirus, rhinovirus, your rubella, which is your German measles, and then RSV is here again. Don't forget RSV is contact and droplet. Last is your airborne precaution diseases that require the N95 respirator and negative pressure room. Your bacterial respiratory diseases, it's actually only tuberculosis. Remember, somebody that is on precautions for TB can come off of their airborne precautions after they have 3 negative sputums for AFB. And then the only other ones are the viral infections that can cause the respiratory illness, which is what we already talked about, the herpes zoster, the varicella zoster, and the rubeola measles. The CDC also talks about SARS and smallpox, and we're in COVID right now at the time of recording this video, and at this point we are doing airborne precautions for COVID. And there's just one final note here reminding you guys that if a healthcare worker is immune, no PPE is needed, and that would be to the zoster and the chickenpox. However, the patient will still need to be in that negative pressure room to protect others that might not be immune. And that's it. All the information in this video is coming from the CDC website. I've included the direct link on this slide if you're interested. The appendix is great on that website. It tells you the disease and the PPE that's required specifically. So if you like this video, this content, learning through questions and critically thinking, please subscribe to our channel. Don't forget to like our videos, and you can always find us at sciencestrategies.com.